The topic for today is types of posterior crowns, that is, various materials available for the fabrication of posterior crowns. Coming to the first one, that is metal ceramic restoration, the use of porcelain fused to metal restorations has grown from the development of the first commercially successful porcelain or gold alloy restoration by Winston et al. In 1950s. While a porcelain fused to metal crown can serve as a strong and aesthetic restoration, patients too often receive this type of restoration for minor irregularities that could have been better handled by conservative treatment or none at all. The indications for this are extensive tooth destruction, caries, trauma, or existing previous restorations, the need for superior retention and strength, an endodontically treated tooth in conjunction with a suitable supporting structure, a post and core, to reconfigure axial surface or correct minor inclinations, aesthetics if all ceramic crown is contraindicated. Contraindications: patients with active caries or untreated periodontal disease, young patients with large pulp chambers, when more conservative retainer is technically feasible, intact buccal wall. The advantages are superior aesthetics as compared to complete cast crown. Strength of cast metal is combined with the aesthetics of an all-ceramic crown by reinforcing a brittle, more cosmetically pleasing material through support derived from the stronger qualities are excellent. Excellent retentive qualities. Disadvantages are removal of substantial tooth structure, subject to fracture before because porcelain is brittle, difficult to obtain accurate occlusion in glazed porcelain, shade selection can be difficult, inferior aesthetics compared to all ceramic crowns, and expensive. Coming to complete cast metal crowns can be used where the breakdown of the tooth structure is severe, to the extent that it has been described in operative dentistry as the final attempt to preserve the tooth. The terms full crown, full cast crown, and complete crown can be used interchangeably with full veneer crowns to describe a restoration entirely made of cast metal. Indications are extensive destruction from caries or trauma, endodontically treated, existing restoration that needs the use of a more conservative restoration, necessity for maximum retention and strength, to provide contours to receive a removable appliance, other recontouring of axial surfaces, correction of occlusal plane. Contraindications that should not be used in mouths with uncontrolled caries, less than maximum retention necessary, aesthetics. Advantages are strong, high retentive qualities, usually easy to obtain adequate resistance form, option to modify form and occlusion, contact areas can be conveniently developed, embrasure areas can be enhanced for periodontally compromised dentition. Disadvantages are removal of large amount of tooth structure, adverse effects on tissue, vitality testing not readily feasible, display of the metal. All ceramic crowns. Advantages are superior aesthetics, excellent translucency, good tissue response, conservative reduction of facial surface, appearance of restoration influenced by color of fluting agent. Disadvantage: absence of metal substructure, reduced strength of the restoration, significant tooth reduction is necessary on proximal and lingual surface, difficulty in obtaining well-fitting margin, not effective as retainer for fixed prosthesis, where observed on functional surface of the natural tooth, where may occur on functional surfaces of natural teeth that oppose porcelain restoration. Precautions are over-tapered prepared tooth on resistance and retention exert wedge-like force, thus stress causing fracture. The main contraindication for all a ceramic crown in the posterior area is that it has less strength compared to the metal ceramic and hence less used. Instead, we can go for zirconium crowns which have more strength compared to all ceramic. Thank you.